everyone, and thank you all so much for being here today. I know we're so happy to all be gathered in this space. I know this has been a long time coming, decades for some, years for many, and I know we were able to do this last year, and here we are again. And first of all, I want to say, Mary was able to testify! Finally, and of course we wish that they used the opportunity to ask her questions because of her vast knowledge and wisdom around this, both legally and historically. And unfortunately, they did not take advantage of the opportunity, but they heard the information, and that was on the public record, and it can be accessed on the website, and we're so happy that that happened. So thank you so much, Mary. Thank you very much.
Thank you for the opportunity.
Thank you. I know we have a great Vermont crew here. We're very, very fortunate. And so we wanted to use the rest of this time here. Obviously, we've got an hour and a half in this room, and we just wanted to highlight, one, some of the key issues coming up on a federal level, and to make sure that we're all on the same page and we understand what's happening, but also really looking at what's happening on a Vermont level. And unfortunately, what we're seeing is this really sort of impulsive, dangerous, destructive response to the federal actions, which we all see as very positive and such a win and such a good direction for health choice and the health of all of us and our families. And unfortunately, our Department of Health has really through the prompting of the American Academy of Pediatrics, pushed this very dangerous H545. And this is a bill that I think maybe some people are aware of. I don't know how much. It just had passed the House. A few of our really strong, good Republicans who took the time to understand the issue did vote no. It's now in Senate Health and Welfare. I'll come back to that because I do feel that it would be good if people are willing, and if this is your thing, to reach out to the Senate Health and Welfare Committee, and maybe through Vermont Stands Up, we can send an action alert that they slow down and stop and really think about what they're doing. And we'll give you some more talking points on that too, but it would be great if they had sort of a barrage of information and people who were concerned about this bill. And obviously we can have Mary speak to that some more in a bit. So first I just want to have everybody take a moment and introduce themselves on the panel here. So Sandy, do you want to start? You might need to turn the mic on, yes.
What, press the button?
It's a clicker on the
There's a
side.
clicker here on the side.
You just push it up.
Here you go.
Is that it?
Oh, you gotta push it up. Yeah, there you
How
go.
about now?
Yep, perfect. All right.
Probably really don't need this. My name is Sandy Ryder. I'm a physician in Vermont, and I've been practicing for, I don't know.
I think we do need
Put that
it.
to your mouth.
You do need
I've been
it.
practicing for, I think, 56 years now, and I've been associated with Vermont Health Choice since its inception in about 2012, and it's been quite an education. I first got involved with this issue when my son was born as a parent, as many of you can relate to, and did my own research before computers in the medical library in Burlington, and decided not to vaccinate him just based on the literature in the stacks there. So I'm on the board of Health Choice Vermont and also a founding member of Physicians for Informed Consent, a California-based organization. And I'm happy to be on this panel. I don't have any speeches, but we'll see how this goes.
Thank you, Dr. Ryder. That's great. And then Mary, do you mind introducing yourself? We all know who you are, of course, but please.
Well, I'm a Vermont lover, and I met Sandy the first time back when the Vax bus came to Burlington, and Dorian and Heather I've worked with through Health Choice as the Vermont team for many, many years. And I am currently at Children's Health Defense. I'm the president and CEO. I was previously the general counsel, but I've been involved in this movement for about 25 years, which is a long time. And as I'm telling people, you know, from that perspective, we're definitely gaining. I am very optimistic. As hard as it still is, I am very optimistic of where we're going right now.
Yes, thank you. And if you guys don't mind, I just saw Representative Nielsen just walked in here, and he's been a true ally. We're very, very grateful for him and all the representatives who will open their hearts and minds to this conversation and believe and support what we're trying to do here. So thank you, Representative Nielsen, and thank you, Mary and Dr. Ryder. And then we also have Vicki, if you want to introduce yourself.
Hi, my name is Dr. Vicki Dubin-Master. I'm a chiropractor of 38 years, a Vermonter of 4. I practiced in New Jersey, New York area my entire life. And it's an honor to be here because it's just such a warm, beautiful community. I found my tribe really quickly thanks to Mary. She led me in this direction. And I'm also a chapter leader for Weston A. Price. I'm the New England, Vermont chapter leader for Children's Health Defense. I started MAHA Vermont, so you're all welcome to be part of that. And we have frequent Zoom calls, and I did that to just help us hold on to our community as things were getting a little crazy after Bobby went with Trump. And it's been really powerful and community building. And the final thing that I'm doing now is the MAHA liaison to chiropractors. So it's been a wild and exciting ride, and it's such an honor to be here. And thank you everyone that's here tonight and that's working with us to help make America healthy again.
Right. Thank you all so much. And then I also want to introduce, we also have Megan Mansell, who's zooming in to join us, and she is absolutely astonishingly wise and brilliant when it comes to all things masks and why we should never have mandates around them and all of the problems with them. So she'll be talking to us a little bit later. But Megan, if you are there and want to introduce yourself, please do.
She's in the waiting room.
You have to let her in, I think.
Somebody needs to let her into the.
Oh, Amy, is Megan still in the waiting room?
She can't hear us, so we just sent for Erin.
Oh, okay, so we'll come back to Megan, we'll get that sorted out there. Okay, so I think one of the first places that I want to start, and I know that many people are probably sort of up to speed because many of us in this room care a lot and we do our research and we do our homework and we try to understand what's happening. But I do want to direct the first question to Mary with regards to just explaining what is happening on a federal level with the schedule, because as you can tell, our state is freaking out, or at least the Department of Health has been freaking out. A lot of providers, practitioners are freaking out. There's tremendous misinformation, and we're trying to push this through. So if you could just explain that. Yeah,
sure. So, as you know, Bobby Kennedy was the chairman at Children's Health Defense and understands the vaccine issue and cares deeply about it. So what he has done so far in less than a year in office was first to say we have to have a commission, a Make America Healthy Again commission. And that commission first said these are the issues we have to address, and one of them was the chronic disease epidemic in children. And then they came out with a kind of these are the things that we have to address, and basically sort of saying we have to look at the vaccine schedule, we have to do new science. So then there was kind of a lull, frankly, but then in the fall, the first major sort of thing to happen was that Kennedy cleared out the Advisory Committee on Immunization Practices. That is the body of doctors, frankly, and pharma people who advise the director of the Centers for Disease Control what vaccines should be on the schedule and what should be federally recommended. And that's a big deal because once something is federally recommended, 50% of that vaccine is bought by the federal government. It's bought by the Vaccines for Children program, and it makes basically all the insurers will then insure it, and the stock of that pharma company goes up, right? Because every vaccine that is federally recommended and then that gets mandated by the states, we're talking billions of dollars, right? So it's a big financial deal. So he clean sweep ACIP, and he brought on people who actually, have credentials and who are questioning, right? So Retzef Levy, a professor at MIT, Robert Malone, Vicki Pebsworth, who had been a PhD nurse at National Vaccine Information Center. So some people who were really critical-minded and willing to really look hard at these things. So that was the first thing he did. Then the second thing he did last year is he moved the recommendation for the birth dose of hepatitis B vaccine, which from my perspective is crazy. I mean, full on crazy to give a baby a medical intervention against a sexually transmitted disease on the day of birth, right? For which they have absolutely no risk. So this was crazy. He moved that, he said, basically the new recommendation, actually that came from ACIP, not from Bobby directly, from Kennedy directly, was you should not give the Hep B vaccine earlier than 2 months. Not a big deal in the scheme of things, right? Like move it back 2 months. Like this was not radical, but huge pushback from pharma and ACIP, huge pushback on Hep B. But then we sort of heard these rumblings in December that a big announcement was coming, but it didn't come. January 5th, beginning of the whole new year, the schedule is being changed, right? We're moving from 17 federally recommended vaccines for everybody to 11 federally recommended vaccines. And the difference, the 6 that are not included, rotavirus, hepatitis A, hepatitis B, flu, COVID, meningitis, those are gonna be for shared clinical decision making. What does that mean? It means it's up to you and your doctor, whether or not you want it. And so that is, now the odd thing is, as I just told the committee, does that really affect anything in Vermont? Nothing, nothing. It doesn't change the federal, it doesn't change the mandates in Vermont, which are probably polio, MMR, DPT, you know, maybe 1 or 2 others. It doesn't change the availability of the vaccines. It doesn't change the insurance for the vaccines. It doesn't change the fact that if somebody's injured for one of the ones that are mandated in Vermont, there is this compensation program that doesn't compensate, as somebody pointed out, you know, in any legitimate, real way. Obviously, I think this is coming from on high. Vermont is one of 19 blue states that are all, you know, basically pushing back and saying we're going to create our own vaccine program. They're very worried where Kennedy is going to go. They know that right at the moment, nothing has really changed for them, but they're very worried about what's moving forward. But as I would be happy to discuss if you want, you know, 545 is going to be really, really chaotic and kind of, you know, they don't know what they're doing yet. Obviously, and you know, and it's interesting, I was talking about this with a scientist recently, and he was like, well, it is bad news that these blue states apparently want to go full steam with the federally recommended schedule, you know, keep vaccinate, day of birth, et cetera. But he's like, what an amazing natural experiment. I mean, there's some truth in that. There really is some truth in that, because what we know based on the real science so far is that unvaccinated children are a lot healthier. They don't have the same kind of chronic health condition. So I would rather not have the natural experiment myself, but at any rate, there does seem to be this very, I call it the vaccine confederacy, right? 19 states, they are all, you know, one political party are saying, we're not going to look at the science, we're not going to follow shared clinical decision making, we're not going to really follow informed consent, we're going to go with this more authoritarian model that's really being driven by the pharmaceutical industry.
Exactly, yes, thank you. And just a few things to point out on that. I don't know if anyone saw, you may have seen the 33-page document that came out that talked about how, well, they compared our US schedule to other peer countries. So they had 20 other peer countries that they were comparing it to. And what they found is obviously the United States, as we can all imagine, was an outlier. And in many cases, we had almost twice as many, you know, injections, vaccines that we were giving. And I just want to point out, and this is where a lot of the misinformation comes into these committees, is the Department of Health came into House Human Services, and they said, oh my gosh, there's so much confusion, and no one's going to know what to do, and we're the experts, and we know the experts, so trust us, we're going to put our own schedule together. And just to put this into perspective of how confusing and how much of a nightmare it's going to be, on the House floor, when they were discussing this for a vote, somebody asked, Representative Joe Parsons, amazing man, he asked the question, what schedule is the school going to follow? And they couldn't answer. So they did not take enough testimony to even know you're the ones who are now creating the confusion. Instead of going back to what Mary has been saying since I've been talking to her about this, is shouldn't it all just be shared clinical decision-making, right? And we know that at the base, that's what it should be, that's the goal. This first step is really huge. So just to put into perspective, again, just sort of the impulse. And to me, a lot of it is also the American Academy of Pediatrics driving this, because they were also very much hand in hand with the Department of Health in testimony. And also just to go back to the hepatitis B piece that Mary had brought up, in my testimony in Human Services, I tried to show the flow of we don't have placebo controls, we have 5 days of safety monitoring with hepatitis. There's been FOIA requests to try to get more evidence of, is there any further safety information? And no, there's not. They received a 1,200-page document at Informed Consent Action Network confirming that no, we have no further clinical safety monitoring that has happened. So obviously I used that to try to point out the fact that this is why these changes are happening. But again, it's kind of a wall. And so hopefully hearts and minds will open. Hopefully we can all work on our representatives, and hopefully we'll get people in there who are elected, who will take the time to understand and to really look at the science and the changes that are happening. And that sort of then also brings me to, I wanted to ask Dr. Ryder, you obviously have been practicing in Vermont for, correct me if I'm wrong, I think 40 years or so, clinical family practice.
55.
Oh, sorry. Oh my gosh, I'm way off. Did you hear that? I know. Thank you, Sandy. My goodness, what would we do without him? Wow. So a little off. 55 years. It's amazing. Thank you so much. My goodness. So I guess my question in particular for you is, people are coming to you with questions and oftentimes confusion and trying to make decisions, and how do you help share trusted resources and places where people can go to get good information when they're trying to sort through the mess and what we're hearing in the news and a lot of the propaganda around it?
Thanks. Can you hear me?
Yes.
Yeah, the whole question on trust is huge in medicine right now. And just to cut to the chase, the only way they're ever going to restore trust, which was kind of wrecked after COVID, is to allow people to make their own decisions and to remove the liability protection from the medical profession and the pharmacies and the drug companies. That's the only way they'll ever get. Because we're all on a roll now, as Mary has said, and the tide is shifting very fast. I think Rasmussen polls have determined that at least half of the population now is skeptical of vaccines, maybe more. Which is, you know, when I first got involved with, say, Health Choice back in 2012, you couldn't even talk about autism. You could not mention the word because it was so taboo. Now it's so in the open, and the things have changed dramatically in terms of the whole discussion around vaccines. On a personal note, the sources that I recommend to people, they can't rely on public health agencies, and sadly they can't rely on the Vermont Public Agency either. And as an example, I was talking to the lead representative from the Vermont Medical Board a couple of years ago, and he said, "I know who you are," whatever. And I said, "Well, look at the VAERS data for the COVID shot. What do you think of that?" He said, "That's a scam. We can't rely on that. We know there's so much over-reporting." And I went, this guy is the lawyer for the Vermont Board of Medicine, and this is maybe what he believes or maybe what he has to believe, because I didn't say anything. I wasn't about to get in an argument with him outside the door of the committee room. But we know it's the exact opposite, that there's so much underreporting that reactions go unnoticed. And I have to say, I did about 15 years of emergency room work, and I was totally unaware of vaccine injury at that time. I never asked children who came in with a high fever or so forth and so forth, whether they just had recent vaccines, and I'm sure I missed a tremendous amount. And I know Sherry Tenpenny, who's a strong proponent of vaccine safety and informed consent. She was a physician, or is a physician in Ohio, and she polled 200 emergency room doctors about whether they knew what VAERS was, and not one of them knew. So I can attest to the truth of that. That's just the way it is. So my chief sources of information are really my patients, people I see in the office. I trust parents more than anybody. And I also trust my own experience more than I trust. I used to love to read the New England Journal of Medicine and Lancet and BMJ, but I've since learned that they're not reliable. So much of the stuff, as the editors of those journals have said, is unreliable because drug companies pay for the results they want to get. The articles are ghostwritten and it's not reliable information. So it's very hard to rely on that. I think the most reliable source is Children's Health Defense, really.
Yeah.
I imagine your readership, Mary, is grown a lot.
It has, but we really are still suffering from censorship. You know, we are downgraded on the Google search engine optimization. We're still off of Facebook's, Instagram, Twitter, not Twitter, we're on X, TikTok, because we were deplatformed off of everything during COVID. We've been in litigation with the government. We were in litigation always to the Supreme Court with Facebook, which is Instagram and Facebook. But yes, we have a lot of followers, and I do believe that the information we put out is absolutely well documented and credible. We have a daily newsletter, The Defender. We have a daily streaming platform. And I think there are some other great sources as well. I mean, I think National Vaccine Information Center is very good and credible. I think Informed Consent Action Network. But as I totally agree with you, Sandy, people can't rely on public health. And to your point about autism, one of the other things Kennedy has done recently was to put onto the CDC website on the page that says vaccines do not cause autism. He said, this is not evidence-based, this is not the science. And then he gave references to science that shows that it's clearly not proven that vaccines do not cause autism. So, yeah.
Yeah.
No, thank you guys so much. Sandy, were you going to wrap up there? Yep.
Just a quick wrap up.
Yep.
So, a couple of things that can convince people that they shouldn't trust the public health agency is that the Vaccine Safety Data Link, which is probably the largest collection of data about vaccine, I think it's about 10 million
Yep.
patients now, and a couple of million of those are unvaccinated. It would be a simple matter to investigate that data, and it's been locked away even from Bobby Kennedy right now, which is kind of shocking as a citizen.
It's true.
And Mary probably knows more about that than I do because she's closer to the inside. And just another personal anecdote, when H545 was first taken up, which was taken up in the first day of the legislature on January 6th this year in Human Services, the lead director of the American Academy of Pediatrics said that we will accept information from trusted sources, including the vaccine injury compensation group, which makes recommendation from the CDC, as long as they encourage vaccination. I mean, I had to listen to that.
You can't make it up.
I had to listen to that 3 times, and this woman she's a lovely person. It's not a personal attack on her, but she represents the AAP in this state, absolutely. And so that tells you how reliable their information might be, how unbiased, because she let it slip. I could tell when she was saying it that she was regretting it, but it was a little late.
Right.
And I'll just add there, thank you, Sandy.
Okay, good enough.
That's Dr. Tyson, who we're talking about, who's the new American Academy of Pediatrics Vermont chapter leader. And I've had a conversation with her, and I just want to say we're all going to have to keep our alerts on, because she was very happy that we lost philosophical exemption here, and I can see her potentially coming for religious exemption, which is obviously very disturbing. And a lot of misinformation, you can tell, sadly, and again, not a personal attack, but there's a lot of indoctrination that's gone on there, and most likely an inability to look at the other side of the story. I did say to her when we were in conversation, I said, do you know how much aluminum is in the hepatitis B vaccine that now you and the Department of Health Commissioner Hildebrand are promoting still for the first day of life? And she said, of course I know what it is, I know what it is. And I said, okay, well then what is it? And she said, well, I don't know, I have to go look at it, And I said, it's 250 micrograms. It's 14 times more than you would be able to give to an 8-pound baby receiving intravenous parenteral nutrition. It's 250 micrograms. And we're talking about, as we said also with your lawsuit, and what you guys are trying to look at is this is a neurotoxin that's replaced mercury, another neurotoxin. So I think most of you guys all in here, I'm sure, are well aware of these pieces, but this is obviously what we're trying to bring forth, and it's going to take a lot of us to try to continue to bring it forth, and that's why it's so good that we can stay connected and have Mary here and do all this work. And this then brings me to Dr. Vicki. I was wondering for you a few questions, but in particular, because of your leadership on MAHA and Children's Health Defense chapter in Vermont, and really trying to regularly bring people together, which is so important so we stay connected during this, what are some of the wins? What are we seeing? I just would love to talk about some positive notes here.
I love keeping the energy up because
Yeah.
that's my goal always, because it's such a hard world right now, and especially in our country and everywhere actually. And if we let our energy and our mood go down, then we're like bringing ourselves down and everyone. But if we can just try to stay positive and focus on all the good things, yet still be active and you know, push where we need to, we're gonna enter this new world, which I believe we're creating as the old world falls apart, in such a better place. So today, I just was hoping to uplift everyone just by sharing what's happening in MAHA. I'm sure you guys know, but it's always good to be reminded, and so we can leave here on a positive note. So the basic aims of MAHA are to reduce chronic disease through better nutrition, cleaner environment, sustainable agriculture, improved healthcare access, physical activity, reducing chronic stress, and over-medicalization. And so the big one, as Allison said, was the changes that just happened in January to the dietary guidelines for America. Most of us never even gave it a glance because we all knew how ridiculous it was, and Weston A. Price has always been on their game with that. So that's one of the things I love about Weston A. Price, but I just want to go a little bit into detail on it. So in January 2026, the HHS and the Department of Agriculture released the new dietary guidelines for Americans, and it's the most significant reset of federal nutrition policy in decades. And they emphasize eating real food, whole, nutrient-dense options, and at the top of, like Alice was saying, it's reversed now. The top of the pyramid is high-quality protein, which to me means meats and fish. And so that's kind of what our recommendations were trying to push us away from, right? Like, stop eating meat and fish, it's really bad for you, and you know, the fats are gonna make you have high cholesterol and heart disease. Well, they were wrong. So healthy fats, fruits, vegetables, full fat, dairy, and whole grains. And then of course, avoiding the highly processed foods, refined carbohydrates, added sugars, artificial additives, and for the first time, they're explicitly calling out the dangers of certain highly processed foods, advising no added sugars for children under certain ages, with limits or avoidance overall. And this is supporting the Make America Healthy Again focus on prevention through nutrition. And this is also influencing federal feeding programs, school meals, which brings us back to Children's Health Day, and broader public messaging, which is really important. So I wanted you guys to know a little bit more detail on that. Another, because we're in Vermont, and you know, regenerative agriculture is how we heal our environment and our food. So $700 million have been in state grants have been put in place to support regenerative practices for soil, water, biodiversity, and farm productivity. And that is great for Vermont. And I can go in more detail on that, but I wanted to focus more on the specific. So the SNAP, we have 18 states and counting that have implemented, and I think Allison just mentioned that Vermont's gonna implement it as well. Or advancing restrictions on ultra-processed foods and incentives for healthier SNAP food purchases through waivers. So basically, we've got 35% of the big food chains in America, like Walmart, Hershey, Nestle, General Mills, and others, pledging to phase out artificial dyes and certain additives. So that's the major food industry thing, but the SNAP is different, and hopefully Vermont's gonna jump on that. Nutrition and child health reforms, we have the Whole Milk for Healthy Kids Act, which is restoring whole milk in schools instead of skim milk or non-fat milk. Operation Storm Speed, which is improving infant formula safety and options. And just so you know, we had the worst infant formula, I think, in the world before this. So, and then there's 60 million added for nutrition funding for Head Start programs. Addiction and mental health support, they awarded 45 million for recovering housing and established interagency autism coordinating committee. Changes, we did that, okay. And then reforming drug and vaccine regulatory framework consistent with best practices, evidence-based medicine and research. So as Mary said, or I think you said, they reconstituted the advisory committee on immunization practice to prioritize independent, conflict-free expertise and gold standard science and vaccine recommendations. They revised the childhood vaccine schedule from 17 doses to 11, with clinical decision-making for the ones that are not on that, as Mary and Allison mentioned. Removal of COVID-19 vaccines from the routine recommendations for healthy children and healthy pregnant women. New Food and Drug Administration requiring vaccines are subject to randomized controlled trial data showing clinical outcomes for licensure in healthy populations rather than solely relying on biomarkers. Policies requiring new vaccines to undergo safety testing and placebo-controlled trials prior to licensure where appropriate. Expanded national NIH research into vaccine safety and potential injuries, improved data collection and dedicated vaccine injury research programs. Broader pharmaceutical reform, stronger oversight of direct-to-consumer advertising with full safety disclosure and efforts to align U.S. prices with those in other developed countries. And reforms to aim address over medicalization, ensure decisions are grounded in the highest quality evidence of real-world impact to protect children and families by prioritizing meaningful measurements of safety and effectiveness. And just one last thing was the Health and Human Services Center for Medicare and Medicaid Services Rural Health Transformation Program. Vermont received approximately $195 million for the fiscal year of 2026, one of the higher per capita awards. So this is under the Working Families Tax Cut Acts and the Rural Health Transformation Program, which was $50 billion over 5 years, and Vermont got one of the highest grants. And so what this can do is reflect its largely rural populations and healthcare access challenges. Funds can help address hospital sustainability, provider shortages, and rural access gaps through expanded telehealth, chronic condition management, behavioral health services, and provider collaborations. So that's really big for Vermont, and legislators can request briefings from the Agency of Human Services, support regulated state policies, and participate in centers through Medicare and Medicaid and rural health summits to share best practices. So, you can ask your legislators how they're, getting involved in this, and encourage them to use it for the best interest of the people. So I think I hit the most important parts, and yes, thank you.
A lot of great wins that we have to keep in mind. And I also just want to point out, I can't help it, and I'm sure you guys have probably had this thought, but this is monumental. I mean, obviously, we're living in this time where RFK has taken hold of Health and Human Services and is cleaning it up and cleaning it out and trying his best, step by step, bit by bit, to get the information out there. And we're living in this time. And I can only think that if we're lucky and we keep working on it, that in 100 years down the road, they'll look back, and this will make me get upset, and say, oh my gosh, look what they did. Look at the movement that happened. Look at the changes that happened. So it's amazing to see that. And one thing I just want to say, I've taught at the Vermont State Colleges for 25 years, nutrition mainly, and I taught Weston Price nutrition for 25 years. I was very fortunate to have a friend who, clued me into that before my kids came along. And one of the things I always talk about is how all of this traditional wisdom that we know was out there for so long in the past and still is there, but has been broken. And now we're trying to reclaim that, and we're trying to get back to that with all of this information and all of the good foods that we are hearing about, and the pyramid shift and all of those pieces. And if we can reclaim that, and we can make sure our kids have that, and then if we can make sure they can pass it on to their kids, and then that wisdom will be held, and we'll be able to carry it through, and we'll be able to say, we don't really care what you think or say otherwise, because we know the truth. We have this information here at hand, and we're going to pass that down through our families and to our descendants. And hopefully that's what we'll get back to.
Yeah. And I just want to share, this all happened in just 1 year, less than a year. It never would have happened if
So good, so thank you. Yes, and I was just going to say one other thing here. We've got 20 minutes. I'll do a little bit more, and then we'll take some questions for sure, because I know there's a bunch of questions and info to share. But I also just wanted to see, I always have a bunch of questions for you, Mary, so I'm trying to pick what's the most important here. So the American Academy of Pediatrics lawsuit, I know you talked about it in committee, but not everybody heard it, so it might be good to touch on that. But then whatever is, you're in there, you're in the thick of this all the time, and traveling and coming to places to do this work and spread the word. You're on the front lines. And what is sort of at the top of your mind and heart for the work we can be doing, or the message, or just any guidance that you might offer?
So guidance, but what was the first?
The first one was if you want to say anything on the AAP lawsuit,
okay.
right?
Yes, I do want to talk about the AAP, and then I want to talk about sort of what I think you guys can and are doing and should be doing. So, so we filed a RICO case against the American Academy of Pediatrics. RICO stands for Racketeer Influenced Corrupt Organizations. Okay. So it's a civil lawsuit. But it's an audacious lawsuit, right? Especially because Vermont and 19 states are saying, we're going to build our vaccine schedule on whatever the AAP says, because they're the experts, right? And it's kind of cool because it's in the same period of time that the AAP is suing Bobby Kennedy right now, right? So they're suing him, and there's a hearing a week from Friday, and they're saying that he's violated the Administrative Procedure Act, but we're suing AAP, saying basically they're a front organization for pharma, and they've been knowingly, intentionally lying to parents and to their member pediatricians for decades, knowing that they cannot say with any certainty based on existing science that the vaccine schedule for children has been well tested and that it's safe. And that's what they've been declaring. And we know that they know that that statement is false for a number of reasons, but important ones are that in 2002 and 2013, the Institute of Medicine wrote reports about vaccines because so many families were experiencing vaccine injury, and they thought we better look at this. And they said in 2002-13, we cannot determine if the schedule is safe. There is not science that supports that. What would need to be done is a retrospective study looking at the vaccine safety link that has about 10 million records, as Sandy Reader said. Retrospectively, look at the health of the unvaccinated versus the vaccinated. Well, allegedly, the CDC and the AAP have never done that. I don't believe that for a second. Of course they've gone back and looked, and of course they've seen that unvaccinated children are vastly healthier than vaccinated children. And so what they've been doing instead is kicking the can down the road and suppressing the information, vilifying the pediatricians, gaslighting the public, and saying that groups like Children's Health Defense are Looney Tunes, right? And it worked for a long time. Let's credit where credit's due. You know, it's worked for a long time. But especially during COVID, the emperor has no clothes, right? The experts lied about everything, and the public knows that. And to Mary's point about Rasmussen polls, about half of all Americans know somebody who died or was injured by a COVID shot, right? So again, I don't think the full truth has come out on COVID at all, and that's something that we deeply care about. But I think that people are a lot more skeptical than they were. And so this lawsuit against the AAP is filed in Washington, D.C. It's in federal court. It's going to be, all of pharma is going to come to AAP's rescue, and it's going to be, hard fought. But what we can hope for is that we get support, so we get past the motion to dismiss, right? AAP will definitely say, oh, these people are wacko, just dismiss the complaint. There's nothing here, racketeering, AAP, how could you even allege, right? That's gonna happen, but I believe that we will get past the motion to dismiss. And then we would get into civil discovery, right? And we would get to see the emails that go back and forth. And it's interesting right now, the Epstein emails that are coming out, we're starting to see there's been a lot of talk between Jeffrey Epstein and Bill Gates about the WHO, about vaccine, about pandemic, So I think that AAP emails and inside internal reports would be pretty interesting, because we're using, as the basis for our racketeering lawsuit, we're using the case against Philip Morris, which was big tobacco, right? So basically, we are alleging that AAP is analogous to the Tobacco Institute, which is basically like this facade. It's just a front organization for pharma. And so what we're alleging is that the AAP used the wires and the mails to send out reports, to send out the Red Book, to send out the Pediatrics magazine, to send out emails to all of their 67,000 pediatrician members. They used the mails into perpetrate a fraud. They said that the schedule was well tested, knowing absolutely that they had no basis to say that. And I think it's got legs, you guys. I think the lawsuit has legs. What can you do? Well, it's interesting. So I went to go see Bobby Kennedy in his new office, which is like, it's not a very nice building. It's not nearly as nice as this. The Hubert Humphrey building in DC is sort of like the new brutalism from the 1960s. It's a really ugly building, but it's a big office. It's very impressive. And I said what you're saying. I said, Bobby, what do you want us to do? We're on the outside. What do we do? And he said, focus on the states. That's what he said, because that's where you are where real change happens. The federal government is a swamp. We're not going to have it not be a swamp in the next couple of years. It's a swamp. It's dirty. It's really hard to make change. Kudos to him for getting the change that he's doing. It's much easier to make change at the state level. Yes. And it's more effective because it's more permanent if we do it sort of in a decentralized way. So keep doing what you're doing. Don't give up hope. We are making progress. Oh my gosh, we're making so much progress when you take a longer view. So keep doing what you're doing. And as you said, we're really not doing anything new. I hate to say it. We're just reclaiming, health. We're reclaiming what humans did for millennia. Like, whoever came up with this idea of injecting poisons at birth, it's so insane, right? So all we're doing is just trying to eat real food, like don't give unnecessary medicines, get out and fresh air.
Are we asking too much?
So keep doing what you're doing. Keep, hanging together. Keep, working with Vicki, who's pulled you all together, and we're making headway.
Good. Thank you so much.
Oh, yes. So the other thing I just want to say, just so people have a sense of when you've taken the time, like I'm sure everyone here has, to dive in and really see research and get the information and try our best to understand what has happened and where we go from here. When I did give testimony to House Human Services, one thing that really shocked me and really just hit home, and I want to share it with you because I think it's important to remember, is when I talked about the 1986 National Vaccine Childhood Injury Act and the fact that that gave a liability shield and protected big pharma and administrators of vaccines from being responsible, they didn't even know that. So that's sort of the learning curve that we're at. They were then focused, what do you mean? What are you talking about? That's so wrong. Is there a law to change that? Literally, that's what I was asked. So it's like, okay, there's some federal action, and then also some states are trying to take some action. So just so we also remember to have that compassion and understanding, and even thinking about what you said, Mary, with we've got these 67,000 pediatricians who've trusted this AAP, who are, I'm sure, very good people, but haven't really taken the time. And so just having compassion around that as we try to do the work and talk to people, I think is also really important. And I did just want to ask before we get into some questions here, there are, I know, because I saw a few healthcare providers here who do work in Vermont, and I just had a few questions for you. I see Dr. Heather Rice and Susie Harris here, as well. Susie Harris, yes. And so I just wanted to also ask you, just as providers, healthcare providers in Vermont, if you don't mind, and I think this might work here, is if you want to come up, or if you can talk loud enough, either way. Do you want to come up? And I just want to see if there's a seat there. We can grab a chair. Perfect. Just what you are seeing in your practice with regards to questions around vaccines, injury around vaccines, if you don't mind sharing.
I brought some props.
Okay, so this is Dr. Heather Rice. Yes, okay.
I brought Raggedy Ann. This is my... I can't hear you.
Oh wait, you might have to turn it on underneath. Okay.
Is it on?
Oh yes,
Yeah,
you're good.
okay.
Yes, thank you.
Can you hear me?
Yes, a little closer, a little closer.
How about now?
Yes.
Not sure.
Keep going.
Can you
Yeah.
hear me?
Yes, yes.
All right. This is my mother's Raggedy Ann doll. And I don't know if you know the story, but Johnny Gruelle was the father who had created Raggedy Ann back in the early 1900s. And he was inspired by his daughter, Marcella, who was vaccinated against their parents' wishes at school. And she was injured and became floppy like a rag doll. And then he found this in his mother's attic and created the whole thing, but it was all, and his daughter died in 1915. And so a bit of Americana that vaccine injury is not new, and yet so many people don't know about it. I wanted to just say that when you asked me the question to prepare, I realized that since COVID, my malpractice insurer has been giving us special education as chiropractors that we need to be more vigilant in watching for both the results of post-COVID, how COVID has affected people's health, but also how COVID vaccines have affected people's health. And so we actually have hours of training now that we go through to watch for when patients come in, to recognize that someone sitting in front of you looks healthy, but they don't fit the traditional way you would think somebody might be at risk for stroke, for example, which we already were trained to always watch for. They're not going to look that way because it's happening in younger populations that appear healthy. But because of the spike protein and affecting the ACE2 receptors, how that can then increase the risks. And we already know about the effects on cardiovascular system in young people. And so we actually, for malpractice insurance, have to be trained on this. And they said, you have to be asking the right questions. And I realized that for years, I have always been asking in my history taking, are you on any medications? Do you have any adverse effects from them? Have you taken any vaccines? Have you had any adverse effects? I've always asked that question. So I have learned from my practice members that yes, that has happened. And it's not uncommon that they say to me, well, my pediatrician and my doctor never asked me that question. So if you're not asking, how do you know?
Right, right.
So that's part of the reality of the new normal, that in my practice we must be asking those questions. But historically, yes, indeed, I have seen vaccine injury over and over, and I do help people with that by helping them to just rebuild their health.
Right.
So
Good. No, thank you so much for sharing.
this is a book that
Oh,
I have
yes.
found has actually been very useful
Mhm.
when patients are asking me questions.
And that's by Paul Thomas.
Thomas,
Dr. Paul
Thomas'
Thomas.
book, and the piece I find most useful is at the end there's an appendix And it just has a very simple statistic on the Appendix C and D, vaccine side effects, and it lists the likelihood of death from all the different vaccine-related diseases. You know, what's the chance of dying from a vaccine injury for that disease?
Right.
And then there's, right next to it is, what's the risk of dying from that disease?
Right. Oh my goodness.
And it's
Shocking.
it's dramatic. So
Yes.
for parents that are trying to weigh the benefits,
Yes.
just showing them that.
Right. And fortunately, so many really amazing books have been coming out that hopefully parents are, seeking that information as they make these decisions. So thank you so much.
You're welcome.
Thank you, Dr. Rice. And then Susie, Dr. Harris, thank you for joining us. And what are you seeing? What are you going through in your work?
Well, first of all, thank you for asking me to come up and say something. Like anybody else who's been in practice for a while, one of the biggest things I see are, and this is pre-COVID, parents who've had children who had a vaccine injury, who then were gaslit, and I've looked at the pediatric record saying that this parent was claiming that this came from this is not true, da da da. And then they're having to kind of slink around under the wire to find a pediatrician that will work with them and let them slow down the schedule or back off something. I've seen children come into my office because I do chiropractic, but I also do a lot of naturopathic work involving, identifying underlying issues that are keeping health from coming around. A lot of that is chemical toxicities and things like that, and I do have a vaccine kit that I use for testing for this stuff. And, children coming in after their 2-month wellness visit, losing eye contact, no longer mimicking sounds, facial expression droops and things like this. And, pediatricians telling the mom, well, no, that I'm sure you thought they were mimicking sounds, but they were not. And so to me, the informed consent and the sovereignty to choose is so basic. And I don't understand, I'm very much interested in understanding how it is that it's an oath to first do no harm, and it's also legal informed consent. It's illegal not to give it. As a chiropractor, I have to inform you that 1 in a million chance I could give you a stroke with my neck adjustment. It's extremely rare. I also have to tell you we could break ribs, we can cause disc herniations. It's never happened to me in 26 years, but I still have to tell you. I also have to tell you that if what I'm telling you doesn't jive for you and you'd like to choose something else, I have resources for you to go look at another way. PT, pain management, acupuncture. I could lose my license if I don't tell you that and then I hurt you. So where is it that the other colleagues of mine are getting away with not having to do that? The parents who've had their kids injured, I've not had anyone not recover in my office, but we don't know about later. Right? Gut health problems, asthma problems, skin problems. Where is their representation? The main thing I've heard them say is they didn't know. They weren't told. It's on the inserts. You're supposed to say, here's the risk, here's the benefit, here's some other options.
Right.
So for me, I've seen parents have these issues and not just parents, since COVID, adults coming in with gut problems, this pain across the liver, bile ducts, pancreas stuff, the increase in cancer. How many people in here know somebody who died suddenly, unexpectedly? And if you talk about it, you're gaslit and you're made to sound crazy. So I would say, with the work I do, I'm also doing a lot of detoxing the spike proteins for people because I'm seeing mental fog, gut problems, liver enzymes, cardiac issues, all the things we know. And detoxing that stuff and getting people out of some of that issue, but we can't, it's new, so I really don't know. I'm giving it my best. But I just, mostly families are feeling that know they've had an injury. They're having a hard time now knowing how to find a doctor. Some of them have been discharged from their pediatric offices. And they've also been, if they go to a hospital because the kid hurt themselves and something's going on, that they need medical attention, when they answer the question that they're not vaccinated, they get treated very differently. I'm not saying anything new for this crowd, I know. But I just feel I'm so grateful for what we're doing, and I just am gonna stay boots in the ring and keep talking to people and giving them resources, because it's heartbreaking to watch the fallout of not being given informed consent and the sovereignty to choose and the respect of a human being to be in charge of their kid's life with their own body's protection.
Right. Thank you so much.
Yeah.
Thank you.
Thank you so much. It is also very comforting, I think, for all of us to know that there are providers on the ground in Vermont who are very tuned in and aware of this and very respectful and wanting to make sure that people do have the information. I work with a family who it literally took them 5 pediatricians before they found one that would respect their wishes around vaccines, and that's just really criminal. I mean, we shouldn't be having that situation, so thank goodness we do have good providers here in Vermont as well. And I just wanted to say, I am gonna have to head out at 3 o'clock, and Amy's gonna take this on, but I know that there were a few questions. Paul, you had one first?
Yeah.
Yeah, so this is for you, Mary. This is a political question, of course.
Louder, Paul.
Oh, okay.
Mike.
Get to the mic, brother.
Thank you, Paul.
So I saw on a clip the other day, I don't know exactly what it was, but it was President Trump and RFK Jr. President Trump said something about the midterms. And when I was at the conference in Texas for CHD, you guys were talking a lot about the midterms as well as being like very consequential. And what Trump said was like, wow, he's gonna be really important when 2026 midterms come around. And I'm curious to know why. I think we kind of have an idea of some of the stuff we've talked about today, but why do you think that is that President Trump said that?
Sure. I want to answer that, and if I could, I want to explain on the issue of like how can it be that they don't give informed consent. Well, you know, I think when Kennedy joined Trump's presidential bid, right, against Harris, Kennedy brought at least 5% of the vote, right? We don't really know. He went from 20 to, something. But I think it's probably like 5% of the vote. And I think that really secured Trump's victory. And so the Maha vote, it's understood at the presidential cabinet level, the Maha vote is a swing vote. It's a very important vote. And so I think that's keeping the agenda going. And I don't know if you've noticed, but Kennedy was speaking in Pennsylvania about a week ago. He's in Tennessee this week. They're clearly putting Bobby out on the campaign trail, which is exciting. And it suggests to me that, as you know, like Trump was out in front of Bobby on the autism conference in the fall. And I forgot to mention that the change on the schedule was the basis for that was a presidential memorandum from December. So I do believe that Trump is really all in overall on what Bobby's doing, particularly within the bureaucracy. And the midterms are going to be consequential. If the Democratic Party takes the House of Representatives, I think there's every indication that Maha is over, right? They've already drawn up articles of impeachment for Kennedy. That's a Democrat has already, pronounced that. And much like with Trump's first term, I mean, they're going to presumably try to impeach Trump. They're going to try to impeach probably all the other cabinet members and just sort of stop the agenda. So the 2026 midterm elections are very consequential.
How do we get Bernie to want to make America healthy again?
I know. That's the $1 million question, but Paul, I'm gonna hang on
That's
for
a
1
great
sec.
question. I
I know.
can't answer that. But I do want to, that's a great question. I want to come back to that
Yes,
because
thank you.
one of the lawsuits that Children's Health Defense was involved in during COVID, actually, was a case in Tennessee. It was Hazelhurst versus the Jackson Clinic. And it was about a child whose father, Rolf Hazelhurst, was a lawyer and worked at Children's Health Defense, and he had been in the omnibus autism proceeding in the vaccine injury compensation program and didn't get any compensation. Severely affected young man, but this happened when he was a baby. And this clinic vaccinated him when he'd had an adverse event and when he was sick at the time. And he's severely autoimmune issues, autistic, non-speaker, et cetera. So it was a case we were really excited about. Aaron Seary and Bobby Kennedy and Rolf Hazelhurst were all on the plaintiff's side and brought the case. And they lost. And the reason for that is malpractice cases. The allegation was that they did not give informed consent. They didn't even give a vaccine information statement. And when you have, in general, every state's law is different, but in Tennessee, the law around malpractice was it below the standard of what other doctors in the vicinity would do? And the answer from the jury was no, it was not below the standard, which is appalling, but this is what it is in the real world. And I also just want to mention on the informed consent piece that when Congress passed the 1986 Act, it actually had a 10-page informed consent form, which did actually have truthful information about the risks and the benefits, and the parent had to sign it. Guess who lobbied Congress to get rid of that 10-page statement?
Bernie Sanders.
AAP. AAP.
Right.
So, you know, the vaccine information statements are nothing, and that is considered adequate informed consent. One thing, you know, at a state level, you could change that. We've seen draft bills before to require that doctors give the product insert. That's never passed.
And you know what, this is actually what we just tried to do with the Burt Amendment, is we were going to make sure that there was some guaranteed written documentation. My suggestion was the vaccine insert, because even, and I remember talking to Dr. Ryder about this, on the CDC website, it specifically says a vaccine information statement does not constitute informed consent. So on that note, I do need to head out. So I just want to thank you guys all so much. Thank you guys all for being here. I'm gonna.
Everybody's so grateful. Thank you guys so much. We have 1/2 hour left. And my name is Amy Hornsglass. I'm director of Vermont Stands Up. And I'm just going to introduce, we have a guest who is attending virtually here. And we're going to hand over the mic to her for a few minutes to explain her area of expertise. And I just have to say that Megan Mansell is my hero. Megan Mansell is a former district education director over special populations integration, serving students who are profoundly disabled, immunocompromised, undocumented, autistic, and behaviorally challenged. She has a background in hazardous environs PPE applications. She's experienced in writing and monitoring protocol implementation for immunocompromised public sector access under full ADA, OSHA, IDEA compliance. She's been writing and speaking about the dangers of masking children in schools for the past 6 years. She's written for the Brownstone Institute. She's written an article entitled "Masks Were Unethical by Design." I encourage people to read her writings on the subject. She's also written a book called "Accommodating Chaos, Correcting the Course of a Plague of Disinformation," which advises schools on alternatives to masking. And so we invited her here for the Vermont Forum to assess the respiratory hazards of masks, which we held in Burlington in 2023. And the main reason I organized that event was so that Vermonters could hear from Megan. She also was a speaker at the Frontline Doctors Industrial Hygiene Multidisciplinary Support Summit in 2022. And Megan addresses why every mask we see on a child is completely unregulated, untested, unsafe, with zero efficacy, fit, term of wear, or medical clearance standards, zero. And that's a direct quote from Megan. That is my favorite quote in the world. And so thank you for joining us today, Megan.
Thank you for having me. I think I was supposed to introduce myself a little, but I think you summed it up pretty good. I wanted to start by saying that this all began with good intentions, because if you know and you spend a lot of time around medically vulnerable and immunocompromised individuals, this may come as second nature to you, but I don't think that's the case for most people. So I really think this started out with people thinking they were helping by jumping on the bandwagon. Well, we need to be doing something and wearing something, covering your face while everybody else can see that, oh, you're trying to be a part of a solution. The problem with that is we went with some incorrect details about the specific pathogen very early, that have now all been proven to be incorrect instead of exhausting the hierarchy of controls, which means looking at specific mitigation measures for a specific hazard, as is common practice in medical settings, as is common practice in anything requiring PPE in the industrial hygiene world. So at first we were told, okay, well, we need hand sanitizer, and that this will fall in a 6-foot arc, and it's, droplet, and it's a fomite issue. And now we know that's not true. And not only is that not true, but the methods that we push not only instill a false sense of security with those that this was all meant to protect, but it also exacerbates the issue. And I have some photos I like to share every time that I speak with anybody, because I think it's easier if you see it. Like, if you see the person most likely in contact with the novel pathogen breathing a focused plume of their exhale emissions over your testing materials at a test site. Now, you don't see a lot of valve-vented respirators anymore, but they were very common at the beginning of the pandemic, and this was always a particulate behavior issue. So with any pathogen that you're looking to correctly mitigate, you need to know particle size, minimum effective dose, the particle to PFU ratio, which is plaque forming units, how much of the material is actually infectious. You need to know the output by during peak transmissibility of the person who's infected, and the term of viability. Does it remain alive and able to infect somebody on a surface or airborne, and for how long? And what is its method of transmission? Because with an airborne pathogen, this specifically was about a pathogen that was 0.06 to 0.14 microns, which is, when you look at a sunbeam in the morning light and you see little bits of dust flying around, what you can see with the naked eye is 50 microns or larger. So we're talking really, 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 really tiny particulates that don't settle or fall in an even arc. They remain aloft and accumulate over long periods of time and remain viable for hours and even days, as this pathogen COVID has been shown to do. So we got all the details wrong, and in doing so, we instilled societally a false measure of protection. And so for me, if I'm writing accommodations or integration methods for a truly medically vulnerable child who has, a laundry list of issues, you have to be incredibly specific and accurate about the methodology which you're claiming to protect this medically vulnerable individual, because otherwise you're just having them play make-believe when it could legitimately impact their life. It's not a good thing. I understand that everybody wanted to be helpful and wanted to be seen as being helpful, but we're really long past establishing that these methods not only didn't work, but exacerbated the issue. I was part of a study design where we sampled masks from school children throughout the day who were given clean masks at the beginning of the day, and then they were run through a mass spec lab to see an absolute laundry list of dangerous pathogens that the children had picked up and had directly in front of oral and nasal mucosa for the duration of their day. While also, another thing that I had an MD take before a medical review board was a study design that we were going and this was kind of to underline that every single mask you have ever seen on a child is unregulated, untested, and unsafe. And if you think about, on a given school day, what a child is asked to do if wearing a mask, if you took that and applied that as a medical study, you can't even have it as a medical study because it's so clearly hazardous to the child. It's an unregulated assessment. The child's had absolutely no medical clearance. There's no consent arm. There's no informed consent arm showing that there are known health hazards, which is why in occupations requiring PPE, you have to have annual fit assessments with 14 pages of medical clearance performed by a licensed industrial hygienist. Where was that for the children that we see in these increasingly restrictive apparatuses? I was pretty quick early on Naomi Wolf's program to talk about tooth, tongue, and lip placement and the linguistic requirements for speech development as well as emotional display. We have so much, there's so much that we emulate as children in learning to speak and in learning to relay emotions that rely on this bottom quadrant of the face, which we've seen the COVID babies now and how much therapy children are requiring just to have what my children were blessed to have as normal developmentally because they were never exposed to that world. And so one of the other issues that I've gotten into pretty extensively is hypothetical perfect capture capacity, which is something that I'd love to dive into in just a minute. I think it would be helpful to look at a few different masks and show exhale emissions, just for the visual to have that ahead of time. This is a cloth mask, and this in front is the exhale emission plume. There are no masks or respirators commercially available that are regulated or tested for exhale emissions, meaning these don't protect the audience from the wearer. These are any PPE you see designed, whether it's a particulate respirator or a PAPR unit, these are to protect the wearer from their environment. It's not the other way around. This is a surgical mask. You can see the exhaled emission plumes going right through it. So it's a bit of, pardon my French, but a road to hell paved with good intentions here. This is a fitted, non-bound N95 respirator. And there are some famous photos that have gone around for years now of Bernie Sanders repeatedly removing his glasses during legislative meetings because they kept fogging up. And I'm not saying this to poke anything at anybody. I think it's important for people to understand why you frequently need to remove your glasses if you're wearing a fitted respirator. And it's because your exhale emissions take the path of least resistance. And here, with this type of respirator, it's always through the nose bridge if properly fitted. This gentleman, I think it's important if you think of, we heard a lot about air travel. And on air travel, you're sitting directly next to somebody. So if he's sitting next to me, I have focused plumes of his exhale emissions being directed in my face. And, or, in a classroom setting. This is a double-masked individual. So this is open gapping on the sides, which is pretty common. Then you can also see he has nose gapping up at the bridge of his nose, where he's outside in cold weather, and you can see the plumes of his exhale emissions. And so when you see it from this perspective, I think it's easier to understand that we're not protecting other people as people have been sold to believe. Now, originally you were told it was droplet and that it was large particulate. More than 90% of respiratory emissions found to be infectious with matter capable of forming plaque-forming units was in the 0.8 to 0.09 particulate size range, which even in 95s are not at capacity to capture. Then you have the issue of people wanting to discuss electrostatics that are for capturing particulates like dust. Electrostatics in respirators wane when moist. The other issue is if you think of this is a moisture encapsulated hazard, as are respiratory illnesses. If you go outside and you turn your garden hose on a mist setting, it's pretty easy to understand that you're taking larger particulates and breaking it down into finer matter. And then that matter has different behavior. It has a different trajectory range, it has a different particle size. So when you are emitting wet matter through these masks, and the greater the fit, the greater the pressure that you're creating when you exhale in them, what has been shown many times in subsequent studies is that you're aerosolizing matter that otherwise would have been in larger droplet particulate, and you're taking things that would have fallen in a more predictable, 6 to 10 foot arc, and you're sending it into the atmosphere of something that accumulates over time. And it's really an environmental mitigation issue where it was taught as in a widespread manner as something that was a personal decision and a personal responsibility. We've never expected children to keep their environments sanitary in classrooms, and children are not notoriously sanitary creatures. So in this study, their masks, you found, absolutely filthy things like fecal matter, and children are, you're required to wear this, so if you drop it in the bathroom, they just put it back on their faces. And there have been some really horrific lawsuits that have come out of the practices of what children have been exposed to, severely disabled children. I helped with accommodations in Wisconsin for a boy who, and there's an article I wrote called Life in a World on Mute. And it's a boy who only spoke sign language and lip read. And nobody in his classroom spoke sign language, and all of his caregivers were masked, all of his peers were masked. So they contacted his parents for two things. For one thing, he was being non-compliant with wearing his mask, but also he was starting to have behavior problems. And that's because he couldn't understand anybody. Nobody could communicate with him, and they were more concerned about him, not wearing a mask than the fact that he was sent to school all day and couldn't understand anybody. Surgical masks came into popularity during the AIDS crisis, as did hand hygiene and hand PPE, largely in dental practices where that started out. And the reason for this is because it's to keep the wearer from getting bodily fluids into their oral, nasal, and ocular mucosa. It's not to keep the audience from the surgeon's emissions. And there have been studies on surgical operating theaters and of wound infection rates for surgeons who wore PPE, masks covering their faces during surgery, and those who didn't. And there's no change in post-operative infections in nosocomial settings for those who didn't wear masks.
Thank you so much, Megan. Yes, thank you. And folks listening, the next step that we're going to be working on as Vermont Stands Up, one of the next steps is to encourage the House Committee on Healthcare, which just heard from Mary Holland, to hear from Megan Mansell, because we have our mask bill 393 sitting on their wall. So if you guys can help me encourage them. Thank you. So we have just a few minutes left. I wanted to let the panel weigh in also, because they've had some experience with this along the way. Mary, would you like to start?
Well, that's a great presentation. We also brought lawsuits against the mask mandates. I mean, they're outrageous. It's just outrageous, really. And I would love to see some prohibitions against future mask mandates. So I definitely support this bill.
Well, it's hard to add anything to what you've already said. In my own practice, wrote I don't know how many exemptions for mask mandates, and some were accepted, some were not. But yeah, I understand the problems with masks for sure. They've never been shown to be safe or don't protect against aerosolized tiny particles. It's such a stupid issue, really, in my opinion. Just have to read the package insert with the mask that will tell you it doesn't work. So.
Hi. When I was working during COVID and with my patients, and we were, I think as chiropractors, we had to mask, right? I don't even remember. I try to block that out of my mind. And I'm a really good not follower of things that I think are stupid. So I just remember letting my patients, when they came in, I let them, when the door was closed, masks are optional. You want to wear them, wear them. If you want me to wear them, wear them. But no matter what, I could not work on my patients because I couldn't breathe. And I felt like I was going to faint when I was working on them. So luckily, when they were face down, I just did not wear them. And I found this company that has these great masks that had rhinestones, and they were fake masks, and I wore them everywhere, and people complimented me on them, but honestly, they were literally full of holes. And then now when I see people with masks on, I actually do open my big mouth because I feel really sad for people that are still wearing masks, and I say to them, are you sick? Are you okay? And if they say, why are you wearing masks? They actually do nothing. In fact, they make you sicker, and I could, and if you're interested, I could give you more information, and especially if it's a parent with children and they're all, their entire faces are covered, because kids, they don't really make masks for kids, so the poor kid's entire face are covered. And these are the same people that now, these young people, you see them, some of them, they're this is their security blanket at this point. And it's such a shame for me to see that, because that's just not a kind of life that you want to live. And God knows what's breeding under those masks, and when they're wearing them every day, their skin problems and just their health in general. So yeah, masks are absolutely, and from what I understand, viruses, if you believe in viruses, they're so tiny, they go through that ridiculous, it doesn't do anything, absolutely nothing. So if anything, it's just hurting everyone and making us disconnected as a society, which is the last thing we want to do. So that's my piece.
All right, so we just have 5 minutes left, but I want to, Rob, you've been waiting. Let's have you come on up. Can you come to the mic and ask a question here?
Yeah. I wanted to ask a question to Mary and Vicki about the partisanship. You talked a little bit about the Republican Party. As a political independent and a political decentralist here in Vermont, a champion of what some call the once and future Republic of Vermont, I'm struggling to make sense of what has happened to the Democratic Party. And I'm really curious to hear from you both. How do you make sense of what has happened? It truly is perplexing.
Well, I'll just share I think parties are the worst thing. I don't believe in parties. I think I think parties are designed to divide us. That's just my personal opinion. I've crossed the line depending on the person that was running, and I never cared what they were, and I'm not a true Vermonter, but I just think parties are really dangerous and that people should ignore parties and just vote for what they believe that person stands for and if they agree with that or not.
I'm not sure I can make sense of what the Democratic Party has become. Kennedy ran as a Democrat and then became an independent, and there have been no more scathing, vicious critics of Kennedy than the Democratic Party. And I think, both parties to a great extent have kind of devolved into tribalism. And it's like they follow the leader and whatever their party says. It's very disheartening, frankly. So I wish I could explain it. I can't.
Okay, John Clark, and I'm sorry, Heather, we're just calling people who haven't had a chance. John, did you want to? And then Debbie was next, and we'll, if we can go kind of quickly with these next two questions, that'd be great.
I'm not a chiropractor, so I don't know what I'm doing here. But I really, actually, this is perfect. I'd like to address this issue because it also relates to what Paul Bean asked, while trying to be a smart aleck at the end, I think. MAHA has not united Americans over vaccines. They remain divided. But when it comes to food, chronic disease, healthier food for our children, our military, our hospitals, Americans agree. And what I'm enjoying, because I work with MAHA every day, all day long, for Bobby Kennedy, well, every day that we have him with us as a leader. It is uniting people. I actually work with Democrats. I'm a Republican. I'm not ashamed of being a Republican. I have to pick a tribe. And I'm trying to get Republicans to toe the line on MAHA. That's my job, not to yell at Democrats, but to persuade conservatives that you can't talk the talk and then not walk the walk. And you don't have much time left with the EPA, what it's doing. So what I want to say is that I'm working with Democrats all the time. And we may not agree on Israel or ICE or transgender freakiness, whatever, that's me as a Republican. But we can agree on food.
Right.
We can agree on cows that are well treated, grass-fed, with good fats, no antibiotics, no hormones. It's a winner. So if we stick with that as Americans, regardless of party, and focus on policies that make our children and ourselves healthier and reduce the healthcare costs and help people not need Wegovy or insulin, it will pay for itself. And we have a food crisis that's pending. That's a plug for my next book. And it's going to get worse, and food inflation is going to get worse. So how do we bring down the cost of food while increasing the quality of food? That means shrugging off 100 years of horrible industrial agriculture. And we've seen what big pharma will do, and now we're seeing the power of big pharma, which dwarfs it. So my pitch is bipartisan unity around food. And by the way, I'm a lawyer, so I've done this. If you and I disagree on pick an issue, but we can agree on cows, on grass, and not being the climate culprits, I am a Lorax, I speak for the cows. And once we find our humanity or our bovine connection, then I might actually be able to talk to you about something else so that you can actually understand my perspective about abortion or ICE or something else without demonizing me, and vice versa.
Right.
So that's, our future is food and farmers, and that's my pitch, and I'm sticking with it. And children. And thank you, Mary Ellen, so much for finding time for little old Vermont, the little
Yes,
place.
yes, thank you.
Thank you. What's your name? Because I was hoping to read your work. You sound interesting.
You sound interesting too. But I know who you are, so I'll email you. My name's John Clark. I have another book coming out called The Coming Food Crisis with Skyhorse, Bobby's publisher.
Great.
And then my May book is called Welcome to the Revolution. And it's about unifying Americans behind food and what Bobby stood for. What Bobby was about throughout his campaign was chronic disease caused by a compromised food system that values profit over human health.
Okay,
That remains our winner.
Yep.
Thank you. I started out in dietetics physics and nutrition and biology, so you're
Talking
very
her language.
interesting and right at my alley.
Tell my wife.
Yeah, go ahead.
So I know today is about vaccines and toxins and everything. And one toxin has not been mentioned, and I just really want to ask a quick question about it.
Yeah, closer to the mic. Closer to the mic.
Closer to the mic.
Oh.
There you go.
There?
Yep,
Okay,
that's good.
should I start over?
No.
No,
Okay. All right, so I'm beyond appalled about what's going on in the world, really, and especially in this country, regarding EMFs and cell phone towers. The whole wireless radiation thing is totally out of control. Nobody seems to be overseeing FCC whatsoever. And I just would like your take on what you think, because I know that CHD is
yeah,
doing all kinds of
Yeah.
things,
yeah,
but in terms of the
Yeah.
bigger picture,
Yeah.
what do you have
Yeah.
anything to say?
yeah. So Children's Health Defense absolutely agrees with you that electromagnetic radiation, electromagnetic frequency is a huge issue, right? We're already going from 4G to 5G, they're talking about 6G, 7G, they're talking about human batteries, they're talking about trying to be able to station this right now with a new rule out of the FCC, be able to station towers and antennas anywhere, any place, no local control. We are strong advocates opposing that. We won a decision in the Court of Appeals for the for the DC Circuit in 2021 saying, FCC, your health guidelines are non-existent. You have to come up with some better rules than this, and they've done nothing. So we are engaged on many different levels in this fight, and I can assure you that Bobby Kennedy gets this. He was involved in that lawsuit in 2021. We're fighting on a lot of levels. So there was a notice of public rulemaking by the FCC on this, trying to basically do away with any local control. We had thousands of people submit comments to this notice for public rulemaking. We've submitted those to the FCC. There's also, we're involved in litigation around challenging the 1996 Telecommunications Act that disallows any opposition by local groups on the basis of health. We've got a big campaign of 100 groups called 704 No More, Section 704. And we're on it in ways that are more opaque. But we absolutely agree with you. This is a huge issue, in part because it's really a part of a growing control grid, right? I mean, why do we need 6G? Why do we need 7G? This is really about a level of human radiation and control and arguably weaponization that's very, very, very deeply concerning. So we're with you. We're doing everything we can. I invite you to come to Children's Health Defense. The electromagnetic radiation program is a very strong one. We have the best litigator in the country in that area. And Miriam Eckenfels, who runs the program, is very strong.
Yeah. I just want to hear from you. Do you have, from everything that CHD is doing and from what you know, do you have any hope that somehow that's going to change? So, that's what I want.
Absolutely. I couldn't do my job if I didn't have hope. But think about it. 2 years ago, could we ever have imagined that Bobby Kennedy would be Secretary of HHS? Could we have imagined 2 years ago that the childhood vaccine schedule would be reduced? I mean, I think we have to we don't know how it's going to happen, but common sense will prevail eventually.
A quick Vermont update. Allison Despathy, who just left the room, just about a week ago, she got 10 minutes in front of the Energy Committee here in the House, and she slam dunked it. Her 10-minute testimony about the harms and how they weren't considering those and being allowed to just post them anywhere they want. And if people join VermontBackPorch.net, you can see the live stream recording of her slam dunk testimony.
Oh, send it
Well,
to me.
you can't argue
Maybe
with
we
it,
can
right?
send it to me.
Yes.
But I was going to ask a question, but then John Parr really set me up because I've been.
Don't blame me.
What?
Don't blame me.
Oh, I can. I've been in the political activism, and I came to the conclusion that we can't get there through a political doorway. Even though Bobby's doing so much, we need Bobby, and he's the first person I believe. And that's why I just want to make a plug that we are going to have a market space with a community capital potential with a membership. Go to edensbay.org on Friday or later. Now, can I come back to, because we've got to do it economically. We've got to lift each other up and invest in our farms. And then we get to the bees, we need the bees, and then we get to those smart meters and everything else. So one of the things that I've noticed, and I'll be real quick, is we're not using our constitutional acumen. People aren't knowing their constitution. They don't know that they have a defensible right to life, and they don't know how to apply it. So that really bothers me, that people are waiting for attorneys to do it for them when you got to come back to the highest law on the land, which says our rights are not coming from government. It's very clear. It's not complicated, and they all their statutes, everything has to abide by that. And a lot of them don't. A lot of them aren't even positive law. Let me come back to my question because I've got much time, and I respect that I take too much.
Thank you, Heather.
So, about the hearing today, and I spoke to the lady right there, and I asked her. I said, did you refute the claim that they haven't had safety testing? And she said, well, I'd like everybody to say what they need to say. So it became clear to me that she thought it was a lie, that there were no safety tests. So my question is, how can I get her that information?
I thought about that, and I think I should add a slide there from the product insert for several vaccines. So for the hepatitis B, for example, it was tested for 154 days on children up to age 10 with no control, right? I should have probably given some examples from the actual product inserts where they'll say, like, for instance, the hepatitis B was no control. But I could have given better examples. The human papillomavirus is tested against just the thing without the antigen, but contains aluminum. To prove to people who are skeptics that there is no, this is an uncontrolled experiment on our children. I could have done a better job on that. I realized it with that audience.
We can help.
Yeah,
So
I can
give it to
every product. You don't need any help. Just go to a product insert for the measles, mumps, rubella vaccine. Go to the product insert. Just look on the internet. Hepatitis B, and you'll find the brand names, and you'll pull them up, and you'll read the fine print. I think it's section 6 about the clinical trials, and you will see in black and white there was no control, or the control was another older vaccine, or the control was it was the same solution without the antigen. I'm not making it up, but I get that she thinks I am.
I need a PDF.
I can send it to you. I'll send it to you.
We can all
no
vote
problem.
these people.
No problem.
With that?
Yes, please do.
Okay,
Yeah, that'd be
thank you.
great.
That's what I wanted for now.
There's copies of Aaron Series chart.
The chart is great, but I think what she's looking for is something that they would find credible. They're not going to find the ICANN chart credible, but they are going to see if I send them 5 or 10 and look up the rest, just the product inserts from the pharmaceutical company to the FDA that says this was our clinical trial. It's all out there in black and white.
Yeah, Rob.
I just wanted to mention one more resource, and Mary, maybe you could speak to the new film from ICANN about the Henry Ford study. I just watched it.
Yeah, it's good.
Yesterday. It's very powerful.
Yeah, it's a great film. It's about the fact that ICANN, Del Bigtree, and Aaron Siri found a mainstream doctor at the Henry Ford Clinic in Michigan and said, hey, would you do a serious vax-unvax study on your patients? And the guy, to his great credit, said, yes, I'll do it. And he did it. And then the results showed what we would expect them to show, is that the unvaccinated children were much healthier. And so he basically, although Zervos had promised them at the outside, I will publish the results, he would not publish them because correctly, he understood that it would be the end of his career, much like it was the end of the career for all of these doctors who've spoken out. So he didn't publish it. So it was brought to the attention of Senator Ron Johnson. Senator Ron Johnson, in a recent hearing, made that study public. And Del Bigtree had been doing filming about the putting that study together and interviewed other scientists and doctors and made an important film. And I think it's a very important study. It's a very important film. There are other medical groups around the world that are now trying to replicate the Zervo study. And like we understand this is the big lie, right? And we know the history of the big lie from, Nazi Germanism. It's easier to tell people a big lie than little lie. We can all relate to white lies. We can't relate, like, how could people tell a lie about vaccines, telling them that it's safe and effective when it's killing and maiming children? But, that's the big lie at the bottom of this.
Thanks, Mary.
Right. Oh, go ahead, Diane, last question.
Very quick.
I so appreciate all of what everybody's been doing and saying today. When I came out of that meeting, the earlier meeting, and saw that people were not making eye contact with you, Mary, they had no questions to ask you.
Yeah.
And they saw all of us around lining the room. And I thought to myself, they're not going to listen. They're not listening. Or perhaps they're listening, but the bond of loyalty to the party line, to the trance, whatever you want to call it, is so powerful.
Yeah.
So to the point, the suggestion is that we now go to the Senate and work our committees there. I have no idea how to approach senators with any more clarity than what you provided. I can't imagine being more clear, more concise, more precise, more professional. But if you can't elicit some interest, what can the rest of us do? How do
Well, you have a power that I don't, right? I mean, you can connect with, well, listen, just the fact that they might not have made eye contact or they didn't ask questions I did specifically want them to take something back, right? And it was filmed. So, it doesn't mean they didn't hear me through half an ear. I think that there were a few reactions that we were talking about with other people. There were a few reactions where they were like, I didn't know that, I could see from their facial expressions like, oh my God, right? Like 90% of the budget is chronic disease, right? 7% of the kids in Vermont have asthma, 12% are obese. Like, I could see a few times, like, I got through to people. Listen, you may not win this one, like, that's a reality, but you have a power that I don't, which is you can get together with the friends in the district and we'll vote you out. Like, we are your constituents.
But I genuinely want to sit with one or two of these people and ask them really directly, what is creating the resistance?
You have great resources here with Vicki and Amy and Allison. You have an amazing team here to go with you. You have an amazing team. And I don't know that they're going to tell you the truth. What seems to me is happening, this is coming from pharma. This is, 19 blue states didn't just all suddenly wake up and say, oh, we're going to have to take action against these actions of Bobby Kennedy that have no effect on our state. They didn't do that. This is all coming from pharma, which essentially seems to have bought the Democratic Party during Obamacare. They run the party.
And then
look what happened during COVID. So I don't think this is indigenous, and I'm not sure anybody's gonna tell you that. They're gonna say, well, the AAP, they're gonna say, we trust our doctors, we trust our pediatricians. We have to take the long view. We have to, what's the alternative?
Right.
What's the alternative?
I agree. And I will do it. And anybody who has any ideas about, and I love what you said, John, about, and I think this is true, to look for what we know we agree on. Because we've got to do an end run around the sort of paralyzed, frozen state that.
And I've thought about using the food analogy actually in the vaccine space. You could try this, but it's like, if we gave seafood to 1,000 people, you know, one person in there might be allergic to seafood, right? Perhaps from a vaccine injury, but that person could die, right? They'd have anaphylactic shock. Like, we would never think of forcing, or some other food for, you know, lactose. There are people who are lactose intolerant, right? There are people who are gluten intolerant, like they have celiac disease. We would never think of compelling people to eat the same thing, right? And they could be seriously medically injured or die. Anaphylactic shock is a real thing. And yet we think we can inject something into people with all the adjuvants that they have, and it's going to be safe for everybody. It's insane. And the 86 Act law says it's not going to be safe for everybody. It's going to kill some people.
Right.
Like, how do you deny that?
Parallel.
I think making the analogy to food is valuable, because look at all the restaurants. You know, are you gluten-free? Do you have any allergies? What do you need? What do we need to know? It's so commonplace, right? And that is related to vaccines, most likely. But, you know, milk allergies, gluten allergies, seafood allergies, people can relate to that in today's world. And so then, you know, making the analogy, but you think it's okay to mandate somebody to get all these shots? It doesn't, you know, it doesn't make sense.
Right, appeal to logic. Got it. Thanks.
And folks, let's remember that Mary was at the table today. You guys reached out to all of them, and our wonderful representatives like Representative Taglavia, who are willing to speak up and stand at a podium today and say, masks harm children. Something I realized lately is nobody has ever told the truth to get rich or to keep their job. And many people in this room have spoken to me about their personal stories of how telling the truth has impacted their living, where they can live, who they talk to, who's in their lives. And so folks, we have all been working so hard, and we do it together, and we found each other through this. And to me, that is the success story.
Absolutely.
And you guys being here today is a success story. And thank you, Orca, so much for filming and staying a little bit late for us. Hello to CHD TV out there and Tessa, who made this happen on international internet. So thank you folks for coming today. Stay in touch, there's more to come.
Thank you.